Good morning, dear students. We are going to discuss joints of pelvis today. So from this picture, you can make out like we have different joints in the pelvic cavity. You can see the sacrum, you can see the hip bone, right? So between the sacrum and the hip bone, at this point, we have sacroiliac joint. Okay. Between the sacrum and the coccyx, we have sacrococcygeal joint. And between the right and left hip bones, at this point, we have like pubic symphysis, right? Okay. Now, when you talk about the sacroiliac joint, the sacroiliac joint is quite strong. These are the strong synovial joints. The articulation is between the auricular surface of the sacrum and the iliac bones. The sacrum carries the weight of the trunk, and apart from the interlocking of irregular articular surfaces, the shape of bones contributes little to the stability of the joint. Now you can see this is the auricular surface of the sacrum and corresponding auricular surface of the hip bone. And here you will see the formation of sacroiliac joint. Right? Okay, so this is the pelvic outlet you are able to see. So from the ischial spine, you are finding there is one ligament extending to the sacrum. You call it as sacrospinous ligament. From the ischial tuberosity to the sacrum also, we have a ligament called as sacrotuberous ligament. Okay. From the ischial tuberosity to the sacrum, sacrotuberous ligament. So in this picture also, we are able to see from the sacrum to the ischial tuberosity, sacrotuberous ligament. From ischial spine to the sacrum, we have sacrospinous ligament. Okay. So in different pictures, I'm showing you the sacrotuberous and the sacrospinous ligament. Okay. So the nerve supply, you will see sacroiliac joint comes from the branches of the sacral spinal nerves. The sacroiliac joint is the synovial joint of plain variety. In adults, it shows interlocking irregularities. The articular surface, the joint is formed between auricular surface of the sacrum, which is covered with fibrocartilage, auricular surface of the ilium, which is covered with hyaline cartilage. The ligaments, what we see here is the fibrous capsule like any other joint, the ventral sacroiliac ligament, interosseous sacroiliac ligament, dorsal sacroiliac ligament, short transverse, short posterior sacroiliac ligament, long posterior sacroiliac ligament, vertebropelvic ligaments, the iliolumbar, the sacrotuberous and the sacrospinous ligaments. We actually can see the ligaments over here, the anterior sacroiliac ligaments, anterior part of the fibrous capsule of the synovial part of the joint we can see. Then similarly, posterior sacroiliac ligaments, posterior external continuation of same mass of fibrous tissue. Interosseous is between two bones, lies deep between the tuberosities of sacrum and ilium. Primary structures involved in transferring the weight. Okay. So in this picture, we are able to see the sacrotuberous ligament. So formed by the posterior sacroiliac ligaments joined by fibers extending from posterior margin of the ilium and base of the coccyx. Okay. Then it passes from posterior ilium, lateral sacrum and coccyx to ischial tuberosity like this, transforming the sciatic knots of the hip bone into large sciatic foramen, this one. Okay, this is the sacrotuberous ligament. Because of this ligament, the greater sciatic knots is converted to greater sciatic foramen. So next we have the sacrospinous ligament from the lateral aspect of the sacrum and coccyx to the ischial spine, subdivides this foramen into greater and lesser sciatic foramina. The above one is the greater sciatic foramen and below is the lesser sciatic foramen. And the landmark of the line of distribution is sacrospinous ligament. So most of the time, movement of sacroiliac joint is limited by interlocking of articulating bones and the sacroiliac ligaments. By allowing only slight upward movements of inferior end of the sacrum relative to hip bones, resilience is provided to the sacroiliac region when the vertebral column sustains sudden increase in force or weight. So this is pubic symphysis, which is secondary cartilaginous joint, consists of fibrocartilaginous interpubic disc and surrounding ligaments uniting the bodies of pubic bones in the median plane. Interpubic disc is generally wider in females, as we have seen in the bony pelvis class. Okay, now between the lumbar vertebrae and sacrum also there is a joint, that is lumbosacral joint between L5 and S1. So anterior intervertebral joint formed by L5 and S1, and here we have intervertebral disc between the bodies of L5 and S1. So two posterior zygapophyseal joints, that is facet joints between the articular process of these vertebrae. Fan-like iliolumbar ligaments radiating from the transverse process of L5 vertebra to the iliac crest. Okay, those are the iliolumbar ligaments. Okay, so this is lumbosacral joint. So then there is sacrococcygeal joint. So secondary cartilaginous joint with the intervertebral disc. Okay. So fibrocartilage and ligaments join apex of the sacrum, base of the coccyx, this point. So anterior and posterior sacrococcygeal ligaments are present, which are long strands that reinforce the joint. So when you talk about clinical aspects, the anteroposterior, like pelvic fractures, we usually see the anteroposterior compression of pelvis occurs during crush accidents, as when a heavy object falls on the pelvis. This type of trauma commonly produces fractures of the pubic ramus of the pubis. When the pelvis is compressed laterally, the acetabula and the ilia are squeezed towards each other and they may be broken. You can see here how they got distorted. Okay, this is one of the X-ray which is showing the pelvic fracture. Okay, weak areas of pelvis. So you are finding the pubic rami, okay, acetabula, region of the sacroiliac joint, okay, and ala of the ilium. Okay, so this is the X-ray which shows the 25-year-old male with displaced fracture of sacrum, and pubic symphysis is also not in the articulated, and they are just separated. Okay, so more severe pelvic fractures separate two sides of pelvis from each other. So pelvis fractures may cause injury to pelvic soft tissue inside the pelvic cavity. In case of females, we have three visceral organs anteroposteriorly. Inside the pelvic cavity, we have urinary bladder, uterus, rectum, anal canal. Whereas in males, anteroposteriorly, we have two pelvic visceral organs, that is anteriorly urinary bladder and posteriorly rectum continuing as anal canal. So in case of pelvic fractures, you will see these pelvic soft tissues may be injured, the blood vessels, nerves and organs may be damaged. Fracture in the pubo-obturator area are relatively common and are often complicated because of their relationship to the urinary bladder and urethra, which may be ruptured or torn. Talking about the sacroiliac joint, the blood supply comes from iliolumbar, lateral sacral and superior gluteal arteries. Nerve supply comes from superior gluteal nerve, ventral rami and lateral branches of dorsal rami of first and second sacral nerves. Movements during flexion and extension of trunk, stooping and straightening the sacroiliac joint permits a small amount of anteroposterior rotatory movements. So this is the auricular surface of the ilium and this is the auricular surface of the sacrum. So correspondingly, the auricular surface of the ilium and the auricular surface of the sacrum will articulate to form the right sacroiliac joint. So pubic symphysis, we have seen like it is secondary cartilaginous joint between the bodies of right and left pubic bones. The surface is covered with thin layer of hyaline cartilage. The fibrocartilaginous disc is strengthened by surrounding ligamentous fibers with the arcuate pubic ligament, anterior pubic ligament. The pubic symphysis permits slight movement between the hip bones, which helps in absorbing shocks. That's it. Thank you.